Welcome to the feed, Bellows Falls and Keene. Today I am here again without Mike. He is on a little bit of a hiatus, but I am here with Patty Kemp and Crystal Morey from Springfield Hospital. They're in the Quality, Risk, and Compliance Department, and we're going to have a big discussion about that right after local events. So the movie this week at the Opera House is the second week of Hoppers. So if you missed it last week, this is probably your last chance. It's about a woman who basically puts her brain into a beaver to learn about. I know I can't have to say this on public television to learn more about animals. So Hoppers at the Bellows Falls Opera House. The classic movie this week is Hoosiers. So try keeping Hoppers and Hoosiers from getting mixed up, which is a really good movie. Gene Hackman, Dennis Hopper, worth watching, and it's sponsored by Coda and Coda. And I'm going to remind everybody yet again that we are a mere few weeks away of the opening of Cabaret with the Wild Goose Players. It's going to be happening at the Bellows Falls Opera House. It's happening April 3rd through the 12th. Tickets are available on the Opera House website. And based upon our discussion with David Stern last week, it is going to be an amazing performance of Cabaret and going to bring a lot of people to the community and going to have a good show. So please get your tickets soon because who knows, they might sell out. So Crystal and Patty, welcome.
Thank you.
Thank you.
Thank you for coming down today. Let's start with just tell us, Patty, you can start. Tell the community a little bit about yourself and kind of how you ended up at Springfield Hospital.
So my name is Patty Kemp. I'm originally from Pennsylvania. How I got to Springfield Hospital? It's I don't know if we have enough time.
The Cliff Notes version.
I'll give you yes. So moved from California here to the Springfield area in 2014. And I'm a nurse and checked, the hospital jobs. At that time, I was an infection preventionist there at the hospital. I've also worked in care coordination and now currently in quality. And all three roles have really great parts that I can pull things into now. And I just love the town. I came from a small town, rural area as well. So it was kind of like going back home.
And I know I did read each of your bios before I came on to prepare. I think you say, quote, I'm finally where I need to be or something like that. Yeah. So
yeah,
sounds like
I love quality.
Yeah,
not just saying that to Mike, my boss. It's just it is a lot of different areas, buckets, and you get to sleuth and you get to teach, and so I find it very stimulating.
I would agree.
You.
And you get to make sure that people are getting the hospital experience that they deserve.
Right.
I think that's
Absolutely.
the key, because people might think, well, how important is that department? But
Right. No,
it is. You guys are
huge.
vital, 100%.
Yeah.
Crystal, I know you have a long background at Springfield Hospital.
So I've been at Springfield Hospital for about 8 years. Originally hired as the executive assistant to the CEO, but 2 years ago I was promoted to the corporate compliance and policy manager. So I've been in that role for a couple of years now. Still a little green and still learning, but I really enjoy it. And like Patty said, there's so many different buckets to learn from, and the sleuthing and the investigation and just making sure that patients are safe. That's our number one goal, is to make sure that patients want to come here. And I think that we play a vital role in that. So
tell us a little bit more about the different buckets.
Want me to go first?
Sure.
Okay.
Go ahead.
Well, Crystal touched on one of the main ones, which is patient safety. And that can go through every department at the hospital, even, cafeteria, housekeeping, and so forth. So patient safety, patient satisfaction, especially over the last decade for sure, hospitals, medical centers are now a business, or considered a business, and patients are our customers. And there is a lot of competition out there, and they want good experiences and safe experience. So patient satisfaction has become a forefront objective, not just for Springfield Hospital, but for all hospitals. So we do a lot of work with that.
And what does that work look like? Like, how do you determine patient satisfaction?
So we have a couple different entities that help collect that data for us. HCAPS is an acronym, and oh god, now I'm not going to be
I
able
know.
to
I was
remember
just
what
thinking about that. I can't remember the acronym.
True. Full disclosure, I did ask them ahead of time to try not to talk in acronyms as much as they could, but it's your normal speak.
Yes.
So
Yeah.
we'll try to. That's probably not.
So we'll put that
do our
in the
best.
footnotes later. But that's a mandated from CMS, which is the Centers for Medicare and Medicaid, that we get that feedback, and that's our inpatient unit completes a survey. It's mailed to them or emailed to them. In the last, I want to say, less than 10 years, maybe there's also another agency that we use for outpatient for the emergency department, and we get a great response from that.
Good.
So we look over those weekly, and we report out on them, report to the board, report to department managers. If there's what's called an alert, if something bad has happened, we could hear about it through that system. Crystal gets phone calls on the compliance hotline.
Yeah. Or no, the customer relations line.
Or the customer
Okay, so people can
right.
actually call in.
Yeah, there's
Yep.
a phone number that patients can call to either give a compliment.
I was just going to say,
Right.
can
welcome
people
those.
call with happy
Oh,
things?
Often,
Yeah,
we
absolutely.
do welcome those. But often, if a patient calls to report a complaint or a grievance, I manage that phone line, and
And you get an actual person.
we do. Yes.
I think that's a because you're saying hospitals are a business,
Right,
And so
right.
hospitals are big sometimes, and sometimes maybe you wouldn't get a person, maybe you get an
Exactly.
answering machine. So I think again, a strength of Springfield Hospital is that you're smaller,
Yes. Right.
you're patient centered. You may even be calling and talking to someone that you know.
Yeah.
And I
Yeah.
think that's a huge plus.
It
plus.
is. And even Bob, our CEO, will come to either one of us sometimes and kind of give us this little paper, and can you call them back? So
okay,
he
so it's
even
reached out to
directly
him.
gets,
Nice.
sometimes we get pulled into right as they're happening, like somebody in the ED. Yesterday we had a walk-in, that we met with and are still kind of trying to work out that situation. So I actually love that we get that much feedback. And the majority of it is amazing.
Yeah.
Unfortunately, you hear about the bad things because people are more
I was
likely to
just going
report
to
bad
say
things.
that because we were, and I do think about that because in the board meetings we get the reports and the color charts, and you guys are in the good colors, but I often wonder when sometimes if the scores aren't where you want them to be, is it more about people that are dissatisfied are going to complain and fill out the surveys versus people that are satisfied don't think they need to fill out those surveys and it doesn't make a difference.
Yeah.
And I think what I'm hearing is that might be helpful for you all
Absolutely.
to hear the good things
Yes.
too.
Yeah.
Yes.
For morale at the very least.
Patty has been doing a great job sharing the positive feedback, from the
Yeah.
NRC surveys that we get. She shares a lot of that information. And I think it's helpful to staff to see that as well. When they
Right.
see that, they
what
know
I'm
the work that
saying
they're
is-
doing is really positive.
Yeah.
So it's hard to hear all the negative stuff sometimes. So this is really important to hear
Absolutely.
positive feedback.
And genuinely, there is amazing. Like I'll read it this past week. I'm like, wow. So Tonya, who's now, I forgot her last name. She's our marketing and Bailey. They're going to incorporate some of the quotes.
I think they already have. I think on
good.
Facebook. I think I've seen
missed
some
that.
posts on Facebook
Yeah,
where they've been doing
excellent.
it. And I think that's important because it's almost like you're getting peer reviews, right? So
Right.
people that are thinking about, should I have my MRI done there? Should I have my
absolutely.
surgery done there? And of course, you're going to say yes.
Yes.
but
Especially your MRI.
to have that confirmed by neighbors and friends that
Absolutely.
yes, that
Yeah.
that it's a good experience. So what are other buckets of quality?
So compliance, we have to adhere to the regulations that are set forth by CMS, and that's the Center for Medicare Services.
You write that one down because I can never
So
remember that.
there
one.
is a document that you can all find on the website called the Appendix W, and it's a document that's like this
Yeah.
thick, so lots to
Insomnia
read. But we
reading.
have to adhere to all of those required COPs, which are conditions of participation. So we do a lot of work on preparing for making sure that we are doing what we're supposed to be doing. So
Because you can have like spot inspections, correct?
absolutely, CMS will come in
And
and
we
do surveys. Right now, we're in that 3-year window to do a survey, and surveyors between 5 and 6 surveys will come in every 3 years and to make sure that we're running the hospital appropriately. So they check everything from the way the hospital looks to how we're running our programs. So there's lots more to it, but in a nutshell, it's just making sure we're doing what we're supposed to be doing.
So there's a lot of checks and balances in place.
Absolutely.
And I think, again, that's good for people to hear.
Yeah.
Absolutely.
And then I know that I think this was, again, I saw this on Facebook. You've done a lot of work with sepsis. That's kind of, you hear about that a lot at hospitals. So you want to talk a little bit about
Sure.
that work. I think you had was it National Sepsis Day or something?
It
There was
was.
some kind of post or
In
something
September.
on
Remember that
Facebook,
for next year.
I think.
I would say that falls under the patient safety pocket, but then that's also making sure we're maintaining evidence-based practice as well. So sepsis is the number one leading cause of death in hospitals. And it can range from, the most common sites would be pneumonia, urinary tract infections, or gut bacteria that gets into the bloodstream. And
Those
once
are the
a-
root causes of it.
Right.
Okay, so I want to
starts-
make sure I
yeah.
understand. Okay.
And once it gets going, your body has this, at times, kind of abnormal response to the infection. And it just sends all these inflammatory, they're called markers. Sorry if I'm boring everybody. But you go into the shock. You can progress quickly into septic shock. So there's a push from multiple organizations to get better education. If we catch it sooner, when they come into the ED, if we catch it sooner and we get antibiotics on board, the mortality rates are significantly decreased. So that's a big push. Sometimes, you mentioned CMS, so sometimes the things that get pulled to the forefront are things maybe that CMS gave us some feedback. I'm like, you guys need to work on this. And I think that's originally how sepsis came to me. But we're going to keep it going. We have a work group, and we do audits. Our infection preventionist, who's also part of the quality department, she tracks
Is that
data.
Blythe?
Yes, Blythe. To make sure we're complying with CMS's sepsis bundle. And I also work with Kira Balcom, Dr. Kira Balcom. She's our med staff quality officer. She's amazing. And she's getting more and more involved with that as well in the committees and work groups to try and, have a presence for the physicians as well, for the providers. So we did that in September. We ordered some fun shirts. And
That's probably what I saw.
yeah, the no sepsis, and the staff was excited to be wearing a T. And we'll probably do it again next year, same thing. Different shirts maybe, but just to generate, conversation like, what is it? And why is it important?
So is there something that is, this is kind of going to be an out there question, is there something that the patient, if they know what things could cause sepsis, and is there something that the patient could do to be more proactive?
Absolutely.
Get to the hospital sooner?
Absolutely.
Is that one thing? Okay. I'm just
yeah.
kind of rolling it back there that sometimes
It's huge. The early
it goes back to
identification.
the actual the knowledge base for
Right.
someone that has something going on. They're like, I should
Don't be
I'll be
stoic.
fine.
Don't stay at home. In fact, two of our recent cases, that's exactly what happened. They waited days and days, and then by the time they come in, they're so advanced. So community education, working with the primary care providers. If you're not feeling well, even things like you find your loved ones are confused and they weren't before. If you're in a lot of pain, if you just seem off, just come in and, I'm worried I might be septic. I had pneumonia a couple weeks ago and I'm just not feeling right. The ED is probably going to not like that I said that now because it's more people, but we would rather you come in.
At the end of the day,
Yeah.
it's the right thing, right?
Just because it's the earlier you catch it, the earlier you get antibiotics and fluids on board, the better.
And I think that's important to bring out too. You mentioned the primary care providers. You guys work closely with North Star primary care providers, so you have the kind of back and forth talk and the education. So they're looking out for it too, and they're looking for so there's a lot of safety nets. It seems like in place
absolutely.
to really for that patient experience.
Yeah.
And that's part of care coordination. And I used to work at Charlestown Clinic as well. And that is, I'm always on the soapbox about that because that is a huge component of, closing those gaps is to coordinate care from the ED back to the Dr. Clores over at Charlestown because we're a rural hospital. our IT programs might not be, big fancy like the bigger hospitals have. So that interconnectedness is not always able to be just like sharing electronic files.
That
Right.
interfacing is missing.
So that's where care coordination is huge. I would like to see it improved. I'm not saying it's horrible, but I think the more we have, the better outcomes will be. That's
Well,
just
I
mine.
think I know the state is working on a lot, and I think one of the things is that's the importance of the state trying to go to a statewide medical records
Yes,
Right.
system, so
absolutely.
that everybody's on the same system,
Right.
and there can be that quicker interaction between what happened in
Right.
the ED and then their primary care,
Right.
knowing what was happening, because
Yeah.
you have to then that's who you go to when you're out of the ED, right? You get referred back
Right.
to
Right.
seeing your primary care. So
It's that
Absolutely.
continuity of care.
Exactly.
So it goes from patient, it follows the patient through whatever level of care they're getting.
Right.
So everyone is aware of what's happening, how they're feeling,
Yeah.
that kind of thing.
I'm actually, it's funny because, again, full disclosure, I'm on the board, but I never knew, I guess I didn't have the full understanding of like how much behind the scenes work there is.
Yep,
There's a
absolutely.
lot.
Yeah.
And right now we're collecting the data from sepsis, and we're working on kind of creating some dashboards to present to the board. So hopefully in the near future, you'll
Yeah.
be seeing some of that data come to life. So it tells a story going forward.
And then you do some other work with medication safety, correct?
Yep,
Because
absolutely.
imagine that's a big one.
That is a big
nowadays.
one. That's a big one for all hospitals. Again, not just us, but and luckily we also have a system that we use for tracking. We work with pharmacy and the department managers to rectify discrepancies where maybe something wasn't charted, but it was pulled from our Pyxis machine. So we've done a lot of education on that. Olga, the ED manager, nurse manager, Olga Carey, she's been phenomenal, and we've worked with her a lot. And her department has seen a very nice decrease in the amount of SEMs or significant events that were reported. Sorry.
I know, but you were quick. You caught it. I know. And you think by now I would know that stuff too, but I don't.
So it's important that the managers are engaged and involved too, because when we come in, sometimes it's like, quality's here. We're not always the first one invited
no.
to the
Yeah.
party.
Yeah.
So, having
Dang.
senior leadership and middle management and even, nurse super users or charge nurses, to get something changed, you have to have all those people vested. So shout out to Olga.
Yeah, and you should have seen in your board report the number of medication errors decline over the past month. So that was really good news to see.
Yeah.
Yeah, and I think just in general, from what I see from the board perspective, is the fact that you all work as one big team. I don't see a lot of ego between departments. I see that you all really, at the end of the day, you want to make the hospital the best that it can be for the community.
Absolutely.
Yeah, and we have a great quality team. I feel
Oh,
like
yeah.
we have a really
Not that you're biased, right?
Yeah, right. But we're really collegial,
best.
and we
Yeah.
we work well together. We all have strengths that we can bring to the table. So I think it's really helpful that to have us together. So I like that a lot.
No, I think I see that in other departments, but I
Yeah.
think that's really, I find it personally reassuring, and I think the community that might still be skeptical, because there's so much talk about healthcare and healthcare reform and what's it going to look like and blah, blah, blah. But at the end of the day, there's people in the trenches working to make it better in their small little worlds. The only thing you control is your
Yeah.
little world of what you're doing. You can't control what's happening
Yeah,
in the bigger
exactly.
picture.
Yeah.
And so I think that's helpful. What about like falls and things like that? How does...
We talk about the tracking or
I'll let you
Okay.
kind of take the lead on that one.
So I'm going to sound like a broken record, but falls are a big deal to every hospital, not just our hospital. It's just the aging population. People who are on multiple medications sometimes can increase you. So fall prevention has been a priority. It's going to continue to be a priority because obviously that could cause more injuries.
course.
So it's a huge patient safety. And, we have made some, I would say we've made some inroads there as well. It kind of ebbs and flows, and you're getting to a place where you're like, okay, good. And then something happens again, which just basically points to quality. It's not like a linear and then you're done. It's a continual loop.
Yeah.
So that's one of the things that I try to, like, sometimes if I come across like I'm coming down on staff, I want them to talk to me about that first of all, but also just like, it's just because we need that loop to keep going, always wanting to improve. And they're, well, we're not perfect. I'm like, no healthcare system is perfect because we're humans, but we should all want to keep that going and get better.
And it's all about prevention, really making sure that the patients are in a safe space and we're doing what's right to make sure that the patients don't fall.
Yeah.
And I'm sure that in maybe some cases you've done everything that you possibly could, and something happened anyway.
Yeah.
That's why they call it an accident.
Exactly.
Yeah.
Because you've got all that, you've got all of your markers in place or your steps in place, and then just something bizarre happens. So I think that's an important point too. That you aren't. That's when you said you're not going to be perfect. You can't be.
It's going to happen
because you're dealing with humans.
Yeah.
And you're dealing with humans that don't feel good.
Right.
So.
Yeah, and we just have to keep our eye on trends. If we're noting that the patients that fall the most are the furthest from the nurse's station, which that there is some research on that, pull them close to the nurse's station so you can have their eyes on them, things like that. So that we do a little bit of that. Again, the department managers are heavily involved in that as well.
So is that like part of your
staff.
sleuthing? Like after an event happens, you kind of come in like the CSI detective.
Exactly.
Yeah, that's exactly what
there you
happens,
go.
kind of.
Awesome. And
So-
then you try to figure things out.
Yeah, and we
talk
also
about-
encourage everyone, no matter what department you work in, to report an SEM or a safety event management issue. Report everything that you see. So it's important for us to see all of the events that happen because we want to make sure we do track and trend.
Right.
We do want to
what's going
identify issues that may be a problem. So, if there's a pothole in the driveway and we've had 6 or 7 falls over the past week, we want to know that so we can fix those things.
potholes in the state of
I was
Vermont?
gonna say,
In March? What? What are we talking about?
But we do track and trend all of the events to make sure that, we're on top of the things that are happening and fixing all that we can.
And would you say that to the general public as well? Like if they've gone and they haven't had a good experience and they've just, instead of allowing you to do corrective action or allowing you to sleuth the situation and maybe make it better for somebody else, they don't tell you and instead they tell everybody else.
Exactly.
Come to us
And
because
that happens.
we really do try to stay on top of all of the patient complaints that come in as much as we can, to the best of our abilities.
Because sometimes if you don't know, if you in an absence if there's an absence of information, you can't correct it. You can't correct something that's
Knowledge
not
is
brought to your
power.
attention. So we have a little more than 2 minutes left. So before we get too far off track, let's find out how would someone reach you to besides the survey, which it sounds like when they get the survey, they should fill it out, good or bad, fill it out because it gives you information.
It does.
But if they didn't, and you do it email now too?
Yes.
It used to be just mail, now it's email?
For the
as well?
inpatient
For the
unit,
inpatient,
there's also texting and phone calls for the outpatient units.
Okay. But if they need to go old-fashioned, how
They
do they
can
go
just-
old-fashioned?
They can give me a call at my telephone, email, and all of that information is available on our website.
website, yeah.
So
I think we have most of it up right there. I
yep,
think I got that.
that's
Yeah,
correct.
There we are. Look at that.
Yeah.
Or walk in, like yesterday.
Yeah. Walk in. Come to the hospital. We welcome people coming to us to.
Again, I think it bodes to emphasize that again, you are not a big corporate hospital of a gazillion people.
Yeah.
You are how many beds?
Well, critical access has to be 25.
Yeah, less than 25
Less
beds.
than 25.
25 critical access.
right.
I think that's important for people to know. And critical
Exactly.
access means that you're there because
Right. We're in a rural area.
Yeah, rural
Yeah.
area.
You know, we're not Dartmouth, but in many ways we're better than Dartmouth, and in many ways their specialties are different too. So, and we work with them a lot too.
And typically our stay is less than 72 hours.
Right.
So that's
and you see people that you might know.
yes.
And people that are working together and people that live in the community. I think that's important too.
Yeah.
It's
This
almost
is
a
your
guarantee
community.
that
Yeah.
we'll see somebody that we know. Yeah.
So any last thoughts for folks? We're getting close. You guys are almost off the hook, but not quite.
Actually, it went fast. This was great.
Yeah.
Just to reiterate, talk to us, or have your son or daughter call us if you don't feel comfortable with it. If there's something, and you're just like, that wasn't just.
That's an
not
important
quite
point
right.
because sometimes a family member sees something differently.
And
so-
that's what happened yesterday too. We had a daughter come in. And that happens a lot. I don't want to say anything. I don't want to be negative.
because we were brought up that way.
Yeah.
Right.
No, we encourage it.
Yeah.
We welcome that.
Yeah,
Awesome.
absolutely. And have faith. There's wonderful programs at Springfield Hospital. we can attest to. And the staff is amazing. I think I'm biased, obviously, but I encourage people to come use us.
Perfect. Well, on that note, we'll say goodbye, community.
Thank you.
Thank you.
See?